Welcome. This is Richard Mollett with the Long-Term Care Community Coalition. Thanks for joining us today. We're going to get started in about 2 minutes. While we do that, a few virtual meeting tips on the left-hand side of the screen. One, please submit your questions in the Q&A at the bottom of the Zoom screen. Please do not submit your questions in the comments. We're going to be monitoring the Q&A, and I'll be using that at the end to have some time for Q&A with our speakers. The comments are if you have any comments that you want to share with one another, or if you're having technical issues, please let us know in the comments and we will do our best to address them. A few items you can see on the right-hand side of the screen here, new at Nursing Home 411. We have a new alert on nursing home providers. We do this twice a year. We do a report with information on nursing home providers. What we found, of course, is that for-profit nursing homes dominate the problem facilities, which we identify as facilities with a 1-star, that are a special focus facility or are a special focus facility candidate. But there's a lot of good information in the provider files for you. And we'll be talking more about them and how to use those data in our February webinar. We have our latest Elder Justice newsletter, When 5 Stars Aren't Enough, which highlights issues in 5-star facilities. Too often people think that a 4 or 5-star facility might be just a wonderful place to get care. Sometimes they are, but sometimes, unfortunately, they are not. It's not necessarily a good indicator of high quality care. We have also our 2024 year in review. And then lastly, our senior care policy brief are all available on our website. For materials from today's webinar, please visit nursingHome411.org/webinar-Medicaid-fraud. And we're going to get started. Let's see. We'll get started now. So again, just before we do that, meeting tips, please again submit any questions that you have for our speakers in the Q&A. Please do not submit any questions in the comments. The comments can be used if you're having technical issues or if you want to chat with others. Okay, and then there we go. A little bit about LTCCC. For those of you who aren't familiar, we are a nonprofit, nonpartisan organization entirely dedicated to improving care and quality of life for residents in nursing homes and assisted living. And we do that through policy research and analysis, systems advocacy, public education, such as programs like this and some of the things I just described on our website. And we're also the proud home to 2 local long-term care Ombudsman programs. All of our materials are free and available online on our website, nursingHome411.org. I'm really excited about today's program. I was able to see it at the National Consumer Voices Conference last year in San Francisco, and I invited the speakers to come today. It's really interesting and exciting to me. We've all, we at LTCCC and of course the Consumer Voice and others, including of course Ombudsman, who have been working to improve care and quality of life for residents for many, many, many decades. Oftentimes that work is really frustrating, and it's difficult to see positive changes sometimes. And so I was really excited to see that the Comptroller's office and the Ombudsman program in New Jersey were working together to combat fraud in the Medicaid program, and as a result, really making a significant difference in improving the lives of residents in facilities in New Jersey. So very quickly, and this is part of the program that'll be available on the website, I believe, but Kevin Walsh is the acting New Jersey State Comptroller, and the Comptroller's Office is an independent agency. It audits and reviews government programs and operations, investigates misconduct by government officials, and scrutinizes the legality of public contracts and works to protect the integrity of the Medicaid program. And again, from our quality of care, quality of life perspective here at LTCCC, and I think for many of you, that really gets to ensuring that the money that we pay nursing homes to provide good care and life with dignity is used for those purposes and not wasted or not funneled off, I would say, into profits, administrative expenses, et cetera, at the expense of residents. Josh Lickball joined the Office of the State Comptroller 9 years ago, no, actually 10 years ago now, excuse me. As the Medicaid Fraud Division Director, Josh leads the division's efforts to prevent and investigate fraud, waste, and abuse in the Medicaid program and recover improperly expended Medicaid funds. And I'll just, if I may, just quickly say that that's really an important, I would say, hook for some of the work we all are doing to improve care and quality of life for residents. We're coming into a time in this country where we're going to see a push for less regulation and potentially less regulatory enforcement, but the integrity of the public funds that go to pay for the majority of nursing home care in particular is important to everybody. It could be a good way of addressing the challenges that residents face in the future. And then next is Lori Facciarosa Brewer, who is the New Jersey Long-Term Care Ombudsman, and she's been the Ombudsman since 2019. I have a tremendous amount of respect and appreciation for the work that Lori does. She's just really been a stellar Ombudsman and a tremendously strong advocate for residents in nursing homes and in assisted living in New Jersey, and truly an inspiration to me in the work that she and her team do. So I'm really, again, glad to have them all here. And with that, I'm going to stop sharing and hand it over to our presenters. So thank you all for being here.
Okay, Lori, the slide shows up.
Laura, you're muted.
Okay. Am I starting out? You can see the name of the program.
Yep.
Am I starting out here?
Yep.
Slide 2. Thanks,
Yes,
everybody. Again, I'm Laurie Facciarosa Brewer. I'm the State Long-Term Care Ombudsman in New Jersey. Right back at you, Richard. Richard is an inspiration to all the ombudsman programs in the country. He's an unbelievably indispensable resource for everybody. So those are very kind words, and thank you so much. I was appointed in 2019 by Governor Murphy as the Ombudsman in the state of New Jersey. I run the Office of the State Long-Term Care Ombudsman in New Jersey. We advocate for individuals living in long-term care facilities by advocating for their civil rights and human rights, and also for investigating allegations of abuse, neglect, exploitation, again, violations of rights. I have to tell you, I've been in the Ombudsman's office now for I guess I'm going on 6 years in this job, so 15 years. And I don't think the Comptroller's office ever came to an ombudsman to do a meet and greet, put it that way. And so I was terrified when I was first contacted by Kevin Walsh, who was at that point a new acting state comptroller. And because I knew he was such a warrior, he's very well known in the public interest legal areas and social justice work, for the work that he's done on fair housing and other things. In the comptroller's office, when the comptroller comes knocking on your door and you're a small state agency, you're like, oh my gosh, are they looking at me? But in fact, what Kevin wanted to know was what's going on in long-term care and how can we improve things. And he, of course, got an earful from me and my staff, as you would from any state ombudsman when it comes to how things are going in long-term care, in particular, once COVID hit. So the way that I approach the job is I want as many partners as possible. And to have someone as powerful as the state comptroller, Josh, Medicaid Fraud Division Director, as an ally has been a really wonderful thing, because I think improving things in long-term care facilities is really got to be an all of government approach. And so I will turn it over now to Josh to talk about the work that MFD has been doing.
Thanks, Lori. The Medicaid Fraud Division was created over a dozen years ago, and we started out as an independent agency, then known as the OMIG, the Office of the Medicaid Inspector General. Before that, we were part of the Medicaid program itself. And around the country, it varies in terms of how states oversee the integrity of their Medicaid programs. Some states do it within their Medicaid programs, and New Jersey, again, over a dozen years ago, made a decision to create an independent body. So OMIG later was changed to the Medicaid Fraud Division and folded into the Office of the State Comptroller. And I think it's really a wonderful setup for us to be independent from the Medicaid program. It gives us an opportunity to view what they do critically and objectively and provide, I believe, really better oversight for the program. And we're able to partner with Lori's office, other offices to learn about facets of the program and then take corrective measures when we think it's appropriate to try to improve those areas. Which we're going to be speaking about with respect to nursing homes at much more length today. And I'll turn it over to Kevin to speak more broadly about our office's activities.
Great. Thanks, Richard. Thanks, Lori. Thanks, Josh. Excited to be here today. I've been in this role since January 2000, right before COVID. And we saw how COVID impacted nursing homes. And I think we had been working here on issues involving nursing homes and concerns about how the money was being spent and how it led to poor quality care in many instances. And so my approach to this, having been a housing lawyer who ran a small but mighty housing advocacy organization that worked throughout the state in hundreds of municipalities, I knew it was important to get expertise, and thus we went to Lori and temporarily scared her, but was relieved that we were able to work together to learn and really understand what it is that we needed to know in ways that the data didn't necessarily, at a nuance that may not have been clear from the data. But Lori and her team gave us a really, really valuable introduction, and we formed an alliance to both on her end ensure that the people she worked so closely with were protected as much as possible and got the best quality care and were able to advocate for themselves, but simultaneously to make sure that our Medicaid funds weren't used in ways that led to siphoning, that led to poor quality care. And so it's been a really, really wonderful partnership in which two state agencies were each able to carry out their mission in ways that both protected funds and protected people who were living in the long-term care facilities. And we'll talk a little bit about ways in which we've done that. But I think it's really important to start by saying this. We are, our particular setup that Josh touched on is one that is, I think, effective because we're really and truly independent. And we have a staff that really does a great job focusing on Medicaid. But the things that we're going to touch on today, because they involve Medicaid and because they involve federal program integrity requirements, for those of you who are from other states, which I assume is the overwhelming majority, it's really important to know that what we do here in New Jersey probably has some analog in your state. And it's hard to know exactly what it is, but there's somebody there doing program integrity work. We're called the Comptroller, but there are probably places that, watchdogs in your state that similarly are guarding against fraud, waste, and abuse. And the ones that are focused on program integrity in Medicaid may not be the same ones that have a statewide broader mandate to focus on fraud, waste, and abuse. But they're probably interested in learning about it. And for those of you who are out there who are interested in that, I'd urge you to find the program integrity folks, which may be in the Medicaid agency. And I'd urge you to find the Inspector General, the Comptroller, the state auditor. All of those have powers that are similar to what we do here. And the combination of them is uniquely effective. And you may need to introduce them to each other, is the way state governments sometimes work, but I'd urge you to do so. So when we first approached Laurie, next slide, please. When we first approached Laurie and her team, we did so because we were working on a theory that we noticed in the data, based on what we noticed in the data, which was that the state of New Jersey is funding poor quality care really as a business model. And we started and issued a report in February of 2022 that very simply and eloquently, and it turns out, I think, persuasively, pointed out that the state was spending over $100 million a year on nursing homes that were perpetually the worst in the state, continuously receiving over an extended period of time, some of them as long as a decade or more, the lowest possible ratings. And we know that's a blunt instrument to evaluate, but the point that we made, and I think it was an especially powerful point to make at that point, given the experience in nursing homes with COVID. The point we made is that poor quality care should be something that is, if at all, experienced, temporarily. That poor quality care should not be a business model. And we showed and presented on a data website that there were 15 nursing homes at that point that for the most of 2 years, some of them for all of 2 years, had received 1 stars. And we urged the State Department of Health and the State Department of Human Services and the governor and the legislature to take that into account when they were formulating policy. And we then issued those reports 2 more times. And it led to some introspection in government and to some dialogue with the media and with others. And it led to some initial modest change in which quality incentive payments were reduced for nursing homes that had 1 stars. So this was the Comptroller's Office initial foray into nursing homes, and I'm proud to say we started a dialogue that continues today. Next slide.
I think also,
Yeah, go ahead,
Kevin,
Laura.
it really shifted the conversation when it came to nursing homes as the shared responsibility between the regulatory agency and the state Medicaid agency. And I think historically, although we have great people running our Medicaid program in New Jersey, historically, I used to work there. Medicaid is considers itself a payer. And so when it came time to look at why are these 15 nursing homes and some others perennially 1 star, perennial have terrible surveys, terrible quality metrics, don't even talk about staffing, and why are we still giving them hundreds of millions of dollars? And, kind of rightly so, the Medicaid agency was like, well, we never really, the Department of Health is responsible for the quality in the nursing homes. And anybody who deals with state regulatory agencies or survey, they have a very, very kind of narrow guidelines that they have to follow. And so I think there's a powerful combination emerging in New Jersey between the Medicaid agency, the Department of Human Services, and the State Department of Health, which is the state survey agency, to really look at the quality metrics. They literally cut out facilities that have a 1 star, so that you can't get a quality payment for any quality metrics that you achieve if you are a 1 star, or if you have 2G or higher level deficiencies. That means in English, if you have some really serious findings during your inspection by the Department of Health. So it really shifted the conversation, and I think I know it's really slow, but I'm there in the rooms and I can tell you the changes are definitely happening.
And before we get to the next slide, Lori, just to add to what you say in terms of the change, one other change, and I would encourage people from other states around the country, is it inserted the Comptroller's Office, the oversight body, into that discussion in a profound way where we hadn't really been there before. So you have the state, in our case, it's the Department of Health that oversees nursing homes broadly, Medicaid, the Medicaid part of that. And now we also have the Comptroller's office, and we're going to speak later on today about our role and the evolution of it. But again, I think that that's one of the real successes of starting from just an idea and a hypothesis in this case, and issuing what turned out to be 3 reports about paying for poor quality care.
All right, next, please. So one of the things that we surmised when we issued this is that one of the reasons there was poor quality care when we issued the 1-star reports is because the money wasn't actually reaching, being spent in the ways that it was intended. And it's, as you saw in the previous slide, there were 15 nursing homes that were on our first 1-star list, and some of them came and went. But of those 15, there are 5 that were on that list that have ties to findings of waste, fraud, or abuse thus far, and those are public, so I'm not revealing anything. Of the 15, there were 5 that it turns out over time, the owners and the people who ran the places had some ties. So pretty good indication so far that there's a connection, not absolute, but likely between fraud and poor quality care, at least according to our initial 15 on the 1-star list. Once we saw that, and as we were starting to understand that, we decided to, as you see on this slide, to investigate South Jersey Extended Care, which was a nursing home that was part of a network of 10 nursing homes in the state, many of which regularly received the lowest possible ratings. And this, we came to call it the worst nursing home in the state of New Jersey because of findings by the Department of Health, because of its star rating. And we really dug in there. We subpoenaed and records. We conducted interviews. It is a 70-page report that, for those of you who are interested really in the anatomy of a scam, this is required reading, I think. What we found is that the owner of the nursing homes in the 90s was thrown out of 2 other states, Massachusetts and Connecticut. He had a history of being barred in those states due to severe deficiencies, including abuse. And he then created a straw ownership scheme in which he transferred the ownership of some of the facilities to his cousin and others to other people. And we found that his cousin essentially functioned as a straw owner. And his brother-in-law participated in a network of related entities that we found were used to siphon money away fraudulently from South Jersey Extended Care, a nursing home in Bridgeton, far South Jersey, south of Philadelphia. They did it by using charities and a network of businesses, and by doing whatever they could to, it seems, to reduce the quality of care and thus to save money. They did things like use related entities by selling things like medical supplies, and then charging that related entity for consulting services. They spent more on consulting services in the years we looked at than actual medical supplies. They relied on inflated prices. They severely neglected residents, according to the findings issued by the Department of Health. They relied on unqualified staff. The director of nursing was not a properly licensed nurse. We looked at the records that they generated in caring for people, which we regularly look at when investigating and auditing Medicaid providers. And what we found is that it was severely disorganized, that it really was missing the critical information that one would look at to see if the care was adequate. We found widespread financial mismanagement. The related entities took the large majority of the money, and they really starved off the nursing home which had $14 million in liabilities at the end of the period we were looking at. And that's because money was moved to related entities as a way of maximizing profit and not making it available to what was really a poorly run, poorly managed nursing home. And as a result of this, and some of the other findings that you see there, we have successfully begun the process of suspending the owners. But as we'll touch on, and I think as Laurie in particular will discuss, this isn't hard. This can be hard because there are obviously, this facility averages, at least when we looked at it, about 100 residents. And so we find ourselves in the position of both really wanting to severely address Medicaid fraud and simultaneously having to do so in a way that is sensitive to the needs of the residents. Josh, I think you're up.
Yep. So just to get underneath that a little bit, what Kevin's speaking to, we looked at thousands of pages of documentation, tax returns, all manner of staffing reports, payroll-based journal, timesheets, payments to employees. We also took a number of sworn interviews, reviewed those transcripts, again, all of which to really nail down as you can see in the report, all of the facts that Kevin's speaking to in each of the areas. And again, we really were looking primarily at 3 areas: the staffing numerically to make sure to find out whether SJEC was meeting the ratio requirements, and this is divided by state requirements into 3 parts of each day, and the ratio changes in each of them. The key roles, whether they were fulfilling the key roles that they're mandated to fill, the documentation that's required, including medication, and whether it's dispensed on a daily basis. And we were looking at the financial siphoning. Where was the money going? And in each of the areas, and I'll just touch on one briefly, staffing, for example, we looked at 75 days in full. And what we found was horrible. For every day of the 75 days, SJEC was understaffed under the absolute minimum requirements of state law. And on average, when we averaged out the 75 days, they were approximately 50% understaffed. In some cases, having just a couple of staff members on site for the entirety of the operation. There is no doubt that that led to far worse performance, far lower quality outcomes for the residents. And so I think one of the real takeaways from the report is that an oversight body can dig into the information that's available and make findings that demonstrate what is happening on the ground, and in this instance, where the money is going, which is not toward the provision of care to residents as it's supposed to be. Some of the key recommendations that we made then flowed from that, which is the overarching recommendation being that the government as a whole needs to look much more comprehensively at who is coming in and owning, and just as importantly, operating these facilities. As Kevin pointed out at the outset with respect to SJEC, there's a nominal owner, and then there's really what's going on underneath the paperwork. Who's really operating? Who are the management companies involved? Who's funding the operation? And where's the money going? In this instance, it's about 90% Medicaid beds, so it's public money. Where is that money flowing to? So what we're recommending through that report, and we're going to be following up on, is having a much more comprehensive vetting process by state government, which would include not just the ownership, but who's managing these facilities. And as part of this, one of the other areas that really jumped out is the land underneath the nursing homes. It's no secret that nursing home, the license is separated in some instances from the land underneath, which creates certain incentives. And that's where money can get funneled from the licensee holder through inflated lease payments to the landholder, often a related party. And that's a way for the ownership and those related parties to pull money out from the nursing home. So there has to be much greater awareness and vetting of who's owning the land underneath these facilities, because that's where a large amount of the public funds are going to. And again, as part of that and related is looking at when that's happening and the money is not going toward the provision of care, but rather to the ownership, the management, related parties. When is there a position of financial distress such that the government really needs to step in and take a more active role through receivership, monitoring, whatever's deemed appropriate? So, you know, those are I think the key recommendations that we made through the report.
We issued the report, and it was really the initial reporting of what we found, but the investigation is ongoing. And what that means is that we're continuing to gather facts, but in the interim, we've shared what we found, and we did that for really two reasons. The most important of which is to protect the program and to protect the residents who are involved in the program. And in order to do that, we have suspended the people who owned the related entities, the people who own the person who owned the nursing homes. And that gets complicated because if they own more than one or they're involved in more than the one that we specifically investigated, they have to be fully removed from the program. Not involved in any way in Medicaid, including in receiving money. And we've delayed that for 60 days, so it goes into effect on February 10th. The other reason we did this is to alert the public and to alert the legislature that there was improper money spent, because we spend billions of dollars a year in taxpayer money on nursing homes, and we both want to ensure that that money is used for high quality care, but also to prevent fraud, waste, and abuse, and incentivizing through lax oversight the money being taken away. So we thought it was very important to, as quickly as possible, advise the legislature and the governor that this was happening. What's interesting about a suspension is that it can be complicated at times, but and it can lead, make us, ensure that the residents are safe. But it is a very powerful tool, and all states that have Medicaid programs, which I think is all states, also have the ability to suspend. They may not always use it. They may not think to use it in a circumstance like this. Your states may not be investigating these sorts of issues, but they could. And a suspension can go into effect. We've here, because there are other ways to immediately protect the program and to protect the residents. We have made it so that it can go into effect in 60 days, but it is a program, it is a response by an administrative agency and by a state agency like ours that can go into effect immediately. So if you see that your Medicaid money is being wasted or people are being treated poorly, know that your state has the ability to quickly suspend Medicaid providers. We have also made referrals to other agencies, and we regularly do that, and we're continuing to investigate. Finally, there was a couple of intervening factors here, some of which Laurie can touch on, but the Center for Medicaid Services had already, as to another one of these agencies, which was another one of the nursing homes, which was perpetually low rated, Sterling Manor, had given a closure date for that. And so that took hold before our suspension could go into effect as to that nursing home. And I think it shows that when it's bad in nursing home, when there is fraud that has impacted nursing homes, Sometimes it's not just the oversight agency that will see it, but the regulators may as well.
Yeah, I mean, you mentioned Sterling Manor, and this ownership group that we're discussing, they had several nursing homes. They were down to two. South Jersey Extended Care was historically the worst of the worst. We had staff in there for many years. When the people running the day-to-day operations stepped away over a year ago and put a management company in, it actually got better. You know, it was very bad. It got better when they weren't running it. They were running Sterling Manor, and Sterling Manor literally closed on less than 1 day's notice on Friday, January 10th. It was known that CMS was potentially going to decertify. The Comptroller's office had taken actions to suspend these owners, but the residents were assured that they would have some time, at least until the end of January, to find someplace of their choosing. And we were working with them, and Medicaid was working with them. And it is purported that one of the owners walked the halls on Friday and said, nope, we're just going to close today. And so that's the kind of dignity and respect with which the residents of these facilities were treated. I am happy to say South Jersey Extended Care is running better right now, but the issues that were identified by the Comptroller, I don't know if you mentioned the staggering amount of fraud that you estimate occurred at South Jersey Extended Care, and that's only looking at one of this ownership group's facilities, is something that cannot continue. You walk into that building, it looks as though nothing has been done to it for 40 years. They were not putting money back into the building. They clearly weren't putting it into staffing. And this, as Kevin referenced earlier, is a business model. Pack a lot of Medicaid people in, and then basically assume that they can't get into any place else. And that was always the concern among advocates and regulators and all of us in this business, was some of the people who are in these facilities may have, already burned out some other places, may have some substance abuse issues, unmet behavioral health needs. But we learned when we closed the state's biggest nursing home in 2022, Woodlands Behavioral Health Center, which did not provide any behavioral health services, by the way, that you could find better places for hundreds of people. And we followed up with everybody who had to leave Woodlands, but they had a lot of time to plan, and they're doing great now. And so that kind of broke the ice and kind of busted up the conventional wisdom that you can't close these bad facilities because where will these people go? And I think what Kevin is doing is really challenging the status quo here. And I think everybody's kind of on board. So Sterling Manor did close. People were essentially sent to a number of facilities, not of their own choosing. Many of them did choose their facilities. But that gives you an idea of what we're dealing with here. Josh?
Yep, next slide. So SJEC took the form of a report that we issued, as did the prior 3 nursing home reports. And that's one type of activity that we can use to affect change in the Office of the State Comptroller. At the MFD level, we can also exclude or suspend parties. And basically, we'll put this into two categories, the suspension category and a debarment disqualification being the second category. The suspension, as Kevin alluded to earlier, that takes effect immediately. I think because of the context of a nursing home with residents, these are their homes, we've been very careful in putting these timeframes onto the suspension. So in the SJEC context, it's slated to take effect on February 10th. We issued that report in December. So we were giving time for the state parties in interest to be able to work through all of the issues that are involved so that residents are not affected in the way that Lori described, where we have to move people overnight or anything like that. So again, a suspension can take place immediately. In the context of nursing homes, we've pushed them out 2-3 months. typically from when we have a finding. The suspensions are temporary. It's pending an ongoing investigation. It could be pending an indictment or a trial waiting to see if there's going to be a conviction of a principal party in issue. In New Jersey, the way to obtain a suspension is our office seeks approval from the Attorney General's office, and upon approval, we're then enabled to take action. The provider that's affected by a suspension has to reapply to become a part of the Medicaid program again, and that's through the reinstatement process. And during the period, and this is really why it's such a powerful tool, during the period of a suspension, that party and anyone who's using that party, so if it's an individual who's managing facilities, providing goods or services to a facility, none of those entities can send money to that suspended party. It really cuts them out entirely from the Medicaid funds. And that's why it's again, such an effective tool. And that's the suspension. The debarment disqualification is a longer term process, because immediately upon receiving that notice, the party can object and seek an administrative hearing, in which case the debarment disqualification action is stayed pending that administrative hearing outcome to determine whether the party will in fact be disqualified from the program. If they are, just like in a suspension, they have to seek reinstatement should they seek to come back into the program. We put a term on them. It's typically, it's for the defined period of years. And so if we prevail, they have to be out of the Medicaid program for that number of years. And again, just like with the suspension, they're not able to receive any Medicaid funds or perform any Medicaid services for people who are beneficiaries in the Medicaid program. So again, just like a suspension, once it takes effect, an extremely powerful tool that we have in our disposal. So those are the basic ways that we can affect change. And MFD excludes hundreds of providers over the course of a year in all different areas within the Medicaid program. So using it in the nursing home context is really not any different from the other areas. But again, as Lori said, part of the pushback that you might see if you're in other states that have not exercised this power previously is from those running these programs, which is you're going to shut down a nursing home. There's going to be, again, some pushback to implementing suspension or debarment actions, which is what we faced and we worked through collaboratively with the other state agencies. And again, like we would honor another point of reference that's I think important is if we find, as we have, that someone is debarred, disqualified, suspended in another state, I would encourage states out there to look for this. That person, that entity can likewise be suspended or debarred in your state. It's in New Jersey, and I suspect all around the country, the tools that are given to the oversight bodies in the Medicaid program are extremely broad and can be used rather forcefully if there's the willpower to do so in the nursing home space. So when we're looking to suspend or disqualify a party, and these are the same criteria that we use as we spoke at the outset to those who want to come into the Medicaid program, we're looking for basically the responsibility, the suitability of that party to be able to come into the program and have the privilege of providing services or goods to Medicaid beneficiaries. And so there's a host of criteria that we can look at, and listed here are some of the good cause bases to keep someone out or to exclude them if they're already in the program. Again, what it comes back to is, are they sufficiently responsible, which is the kind of the catch-all, are they sufficiently responsible to provide goods and services in the Medicaid program? If they have a crimes that they've committed, if they've presented false claims, if there's a belief that they've violated laws or regulations, or have ethical issues in whatever occupation or trade they occupy, that those are bases to suspend or disqualify a person or an entity from the program. And we've done this again now many times in the nursing home environment, and hundreds of times in other areas in the Medicaid program as well. Next.
Thanks, Josh. Leave it to an ombudsman to ask the question. I see my colleague Carolyn Fenn asks, will the residents be dislocated or relocated during a suspension? There have, as Josh indicated, been previous suspensions in the program, and a variety of things can happen. I don't know if you want to take this, Kevin, but the state could go in and put a receiver in there. That did happen in one situation. The facility could sell relatively quickly, and then that suspended owner is no longer part of the program. But there is always the looming possibility, right, that a facility could close for good. And so there's quite a bit of uncertainty related to this. And so kind of the larger issue is we cannot allow the state to continue to spend billions of dollars, especially where we suspect fraud, and deliver poor quality care to the residents. We know from experience when residents move out of some of these facilities that have been suspended or closed by the state of New Jersey, that they are almost to a person doing so much better than they were in that other facility. But it does create a bit of a quandary, right? Because there is a lot of nervousness among residents when they hear that a facility is being suspended, that the owners are being suspended, and that the Medicaid funds could stop flowing. I think it's a real credit to our working relationship with the Comptroller's office and his relationship with the other state departments involved here, that he has really worked with all of us to ensure the least amount of disruption possible for the residents. And I really and truly appreciate that, because his goal is not to disrupt people's lives. His goal is to protect the taxpayers of New Jersey and the residents living in these long-term care facilities. But there are real concerns there. One of the things that we do as an ombudsman program is we try to go in and work with the resident council. We try to go in there and talk to the residents, answer their questions as best we can, lay out what the potential scenarios are, and push the state to perhaps get a receiver where we think there might be a little bit too much instability in potential for instability. But that's kind of the ombudsman role: be there for the resident, really try to empower the resident councils, make sure that the flow of information is there. If there are any needed notifications around closures or transfers, that those are done with compassion and within the legal requirements. Kevin?
Yep, and as Laurie touched on, New Jersey law permits a receiver in two instances. One, if there's really poor quality care, and two, if there's a risk of closure because of shaky finances. The way a receiver works is that under New Jersey law, and there may well be laws like this in your state. Under New Jersey law, the Department of Health can go into our state trial court and point out that certain criteria provided under state law have been satisfied, and ask a judge to allow the appointment of a receiver who can have a wide array of different powers depending on what the harm is or what the danger is that has to be addressed. But the receiver can exercise all of the powers that an owner can exercise, and can completely take over and run the nursing home. And if a decision has been made by the different entities in the state that make these sorts of decisions, that it is better to keep a nursing home that will be suspended from Medicaid, or owners or related entities that will be suspended from Medicaid running. The state has the ability to ensure that that will happen. It's not easy, but the state has the ability to ensure that that will happen by putting a receiver into place. And thus far, as a result of our suspensions, there are 2 facilities that currently have receivers in them, and that regularly report on a monthly basis about what is occurring to the trial court. I think the other thing that's important to note is that if there is a suspension, the Medicaid funding can be cut off very quickly, or soon after the provider has been advised. I'm not speaking about any specific nursing homes right now, it's important to say. But what we are mindful of is that it is very possible that a nursing home will simply put in new straw owners, or will recreate the fraud in ways, or the waste or the abuse in ways that perpetuate the harm. And so it is very important, even to evaluate whether owners should be permitted, whether owners, especially owners who have ties to fraud, should be permitted to choose their successors. Because given the history we've seen of straw ownership, it's very, very possible that they have just traded places. And that is important for any Medicaid agency or Medicaid program integrity agency to be mindful of. And I think it's especially risky to look at the mortgages in nursing homes and for the property companies, because that is a high risk for siphoning of funds away from the nursing home by mortgaging it at significantly more than the market value. So it's I think overall, certainly in New Jersey, we've figured out, and I would urge you in your states and with your Medicaid agencies to appreciate that oversight of nursing homes involves not just issues like does the nurse provide appropriate quality care, but it really involves, and whether it's as part of evaluating for fraud or of evaluating whether the new people should be permitted to run it, it's really, really important to understand what the business operations are. And I think overall that is in this country is something that would be valuable for regulators to focus on, is understanding how the businesses of nursing homes work, because it is very easy to hide fraud, waste, and abuse in complex corporate structures, and to place straw owners in.
Right. I mean, Kevin, in South Jersey Extended Care, what were some of the services that we were going to related parties? Just so everybody understands, related parties are the same owner, is providing staffing, or is, those payments are going to the same company.
Yeah, or it can be a cousin or a business partner. Worth looking at the report in detail, because we lay out exactly how it happened based on our investigation. But there, the vast majority of money left South Jersey Extended Care and went to one of 3 people who had a role in running it. The owner had barely ever been there, was his testimony, as we talk about in the report, and the person who was running the staffing company and the food company was somebody who had been thrown out of other states and who took a step back, but was actually more involved in the day-to-day than the owner was. And so it's really, really important to understand the flow of money. And sometimes it's important to get beyond the public reporting that's there, because the fraud may be hidden behind multiple layers of corporate entities that were set up specifically for the purpose, it seems, of hiding the fraud. So next slide. One of the things that one of the responses to the risks that we've seen in nursing homes is something that the federal government has also recognized is important, which is not just auditing and investigating and tracking the money, but evaluating whether the people who are seeking to own nursing homes should be permitted into the program, whether they can be trusted. Not always an easy task, but a really, really important one. And so the State Comptroller's Medicaid Fraud Division for many years has been involved in evaluating whether other kinds of high-risk providers, durable medical equipment is among several others, whether they should be permitted into the program. And CMS recently required that state Medicaid program integrity programs place skilled nursing facilities as a high-risk provider, and they have to be vetted prior to being permitted into the Medicaid program. If I had one message coming out of this that you could bring back to your state, it would be to find out which entity in government is doing the high-risk provider investigations and reviews, and help them understand what the risks are. We've laid out in this report, and there are certainly other either criminal prosecutions or civil enforcement that has occurred around the state that show examples of what the risks are. And this would be a great way so that we're not throwing people out of Medicaid necessarily, but rather we're not letting people who come in with shady business deals, with things that just don't make sense, with indications of straw ownership. Those are all things that under federal law states are required to look at before they let somebody into the Medicaid program. And that occurs separately from the Department of Health's analysis about whether they should be permitted to be a licensed nursing home. The Medicaid analysis and the analysis done by the Department of Health as a regulator hopefully go together and are inform each other, but they are separate analyses. And so in theory, someone could be licensed by the Department of Health and not be permitted into the Medicaid program. Next.
We talked
So-
about the receivers, so I think we kind of covered slide 13
Yep.
now.
Agreed.
So I wanted to make a pitch here for a transparency bill that we have pending in the state of New Jersey in the state legislature, which would require audited financial statements of every related party. It wouldn't solve everything. It doesn't replace the hard work and months of deep labor intensive work that the comptroller did. But we really are just scratching the surface right now in terms of understanding the spending, the actual spending by these nursing homes in New Jersey, and I would venture to guess across the country, how much is this actually going to direct care?
And my final thought on that is transparency is a huge part of this. Unfortunately, we're dealing with self-reported information by and large. So state government officials need to come up with some way to spot potential flags, factors that warrant a deeper look. And through that deeper look, I think is where one can find the fraud, waste, and abuse in the system. The information that's supplied is a start point.
Yeah, I also wanted to say that there's a lot that Ombudsman programs can do. We worked with the state when and if a facility is going to close. Like, we are usually at the table, have a work group, and we are advocating for the residents. The managed care organizations, New Jersey's all managed care, they should all have care managers. They're working with the residents to do options counseling. So there is a team effort that begins even like once the suspension is issued. We are already out there talking to residents, trying to get a feel for where they're going. What you don't count on is the owner just pulling the plug before it's even becoming essentially into effect. But there are things that you can do. I'm speaking to the Ombudsman. Generally, people haven't been disrupted so far by any of these suspensions because there have been sales or there have been receivers put in place. And that's you don't want to disrupt the residents. You only want to disrupt them in the sense that you can get them to maybe a better place of their choosing.
Well, thank you all very much. Just a fascinating and powerful program. I feel like we just kind of you guys went in depth into a lot of things, but I feel like we also just skimmed the surface of ways in which we can try to attack, get at some of these issues. We have a ton of questions. It's 1:59. I actually have a couple of quick slides at the end. Let's see if I can share that. It'll come out. Here we go. Our February webinar is going to be on the 18th at 1 p.m. And it's going to be a nursing home update, 2 parts. One is going to look at how to evaluate if your facility has enough staff. We've started using an improved methodology for assessing nursing staff adequacy. This could be useful for people who are focused on a single nursing home, whether they live there or their loved one lives there, or they're an ombudsman, or if you're looking at facilities in your county or your state as an ombudsman or as a policymaker or agency staff, et cetera. And then second, we're going to present some new resources that we have been developing on transfer and discharge. We have 3 fact sheets, including one especially for ombudsman that is coming out as a result of the new federal guidance around transfer and discharge that is going to go into effect at the end of February. And then lastly, head to our website for materials from today's webinar, for staffing and provider information in our data center, et cetera. We have many questions. If I could trouble you guys to hang on for another 5 minutes or so, we'll go through
I'm fine.
if that's
Yeah.
okay. That would
Yeah.
be great. And let me stop sharing and call them up again. So John Rodat asked, what financial data did you use that are available to the public, either in an online portal or through Freedom of Information requests?
That's for the comptroller
Um,
or Josh.
I think the short answer is there's not going to be anything that would be making available that's not already referenced in the report. And there's a lot that's referenced in the report in terms of specifically with respect to the SJEC investigation, if that's what.
I think the question is what public records are available. Say somebody else wanted to take a run at this. What is available? What can you get through a FOIA request?
Yeah, I think that there, I let me not speak specifically as to any particular report or nursing home, but there is very valuable information available in federal and in New Jersey state cost reports, some of which, if you can identify an outlier, what might indicate where it would be good to look. But it is also really important to get past that sort of information, because that alone, if one of the things that we found was that they had flat fee contracts for staffing, and the related entity, who was somebody who was in on it, right, got the same amount of money, whether that company complied with minimum staffing requirements or not. And so there was a built-in incentive to not comply, because their profit was directly tied to how much staffing they did and they didn't provide. That is the sort of thing that no rational business person would engage in for, but the people who were running this enterprise did so in a way that that maximized profits, but gave them plausible deniability. And they would just say, well, we might not have had the staffing there, but nobody ever called us on it. And those are the things,
right, like the Department of Health isn't in there every day.
Yeah, those are the sorts of things that you can find by looking into their records, which are not going to be public records.
Thank you. Elon Caspi asked, I said, thanks for the invaluable information. Since according to one estimate, about 20% of people living in assisted living receive care and services under Medicaid, to what extent is this critical work being done in the assisted living sector?
I can say that we haven't looked into assisted living and Medicaid. Probably worth someone looking into. It's not anything that we've done. Josh, anything you'd add there?
No, it's not a specific area. We've been for a time now focused on the nursing home space specifically, but
I like Rita's question. I'd like to know the answer.
So Rita Duncan asked, is there a clearinghouse for use by states to determine if owners or operators have had issues in other states so licensing may be declined when approval is being sought?
so there's some general state clearinghouse information with respect to Medicaid suspension, Medicaid exclusions, which would also pull in CMS actions. But beyond that, in terms of like qualitative clearinghouse, who's a bad operator, I'm not aware of resources that would provide that kind of information, but there are state resources for Medicaid exclusions, debarments, suspensions, and CMS actions.
And there aren't a lot, I mean, you don't really know a lot about who the backers are, like who the investors are a lot of times. You know, there just isn't a lot of scrutiny on those individuals.
And that's really the fundamental problem, is that you'll see a straw owner who's put forward for vetting, but that's not really where the decision making necessarily is, and that's definitely not where the money is coming from or going to necessarily. So it's incredibly challenging when you really don't at the front end see the party or parties that you really need to be looking at. So you have to, at the outset, do more digging.
Thank you. I would just, I may quickly add that one of the things that we've and others have advocated for with CMS is to have them address ownership more broadly, and they have utterly refused. So they look at at nursing homes on a facility by facility basis, and we say, well, you have ownership groups, you have the affiliated entity data, which are the chains, you have other ways of getting at this information, and why aren't you using that? And they have just unfortunately refused to do that. I'm going to do one more question. I think we've answered a few or touched on some of these. I'm going to go to Tony Chicotel. The concern about where residents will go is by far the biggest barrier to shutting down the worst nursing homes. Can you please tell us more about what was done to ensure residents in the closed facilities were safely and appropriately transferred?
Yeah, I can speak to that. I think I kind of referenced it earlier that we get in there right away. We already have as an ombudsman program, we already have the DFIS penetration into the nursing homes in the state of New Jersey, right? We're not regulators. And so we're in there anyway. We might have a volunteer, we might go out there proactively through our resident experience program, or we might go out there for investigations. But we do there's generally a master list of everybody in that facility that's created. And the Department of Health, the regulators, Medicaid, the Ombudsman's office, and I said like the managed care organizations who have care managers who are responsible for those residents who are on Medicaid, we're all kind of working off of that list, and like who's doing options counseling and who's making sure that the preferences are reflected. So there's usually a working group of people, you know, who are working on this. But yeah, that's the biggest thing. And residents are really, really freaked out. And you know, Tony asked the question, how can you make sure they're safely transferred? On some level with Sterling Manor, the state, we were assuming that, you know, the goodwill, what were we thinking of the owners to not stop paying for the consultant who was running the place. And basically they pulled the plug, and there was no receiver in place to take over the finances, right? To use the Medicaid funds to run the facility. And so it had to close. So that's the beauty of the receivers, is at least the state has control of the money that's coming in. So you don't, you know, and you can do what we did at Woodland, which is like pay the staff, you know, extra to stay until the facility can wind down. But you have to have a plan. And it's hard to do that if you don't have control of the money. Right. Because you're always at the tender mercies of that owner.
Thank you. Thank you. I think we'll wrap with that. That was, thank you both. Thank you, the three of you, very, very much. Really appreciate the work that you do, and really appreciate you sharing it with us here today. Thanks, and look forward to speaking with you again.
Thank you, Richard. Thanks, everybody.
Thank you so much for having us.
Yep.
Thank you.